I'm Mirielle Diaz. I'm a physician at Boomerang Healthcare. I'm board certified in physical medicine and rehabilitation. I have additional board certification in sports medicine as well. I completed a fellowship training in spine care. So my background allows me to provide a very comprehensive approach to patient care and focus not just in patient's pain, but also in restoring patient's function. So when I was in medical school, I really enjoyed many different specialties. I loved when I did my rotation in internal medicine. I loved it when I went to neurology. I was fascinated with anatomy, physiology, all these things. So when I found out about physical medicine and rehabilitation, I felt it was the perfect fit because it integrated a lot of different disciplines. So in physical therapy and rehab, we can see the patient as a whole, and it allows me to do the regular treatment planning that we would do in terms of the patient's own health, but also their function, how their conditions or pain affect their quality of life, which is part of rehabilitation. So many of the patients that I see have been suffering from chronic pain for a long time. We do see acute injuries as well, but many of our patients have chronic pain. Um, the treatment and the goal with the patient will be to provide a treatment plan that could include anywhere from physical therapy, medication management, but there's also another whole side of pain management as well that include injections and minimally interventional procedures as well. I have a particular interest in regenerative medicine, which harnesses the body's own healing capacity to relieve pain as well as restore tissue function. I think it's very important to keep up to date with the advances in in medicine to be able to provide a patient with well-rounded care. One of the Boomerang's healthcare uh, strength is the multidisciplinary approach. Patients will come in, and you have to be very mindful that besides just having pain, the injury or condition that they have impact many aspects of their life, including their emotional well-being, their family relationships. So it's very rewarding to work with a good group of people, like do teamwork. We work very closely to our physical therapist. We provide cognitive behavioral therapy. Our functional restoration program addresses many aspects of patients' life, including nutrition and different lifestyle changes that they can make. We also work very closely with referring patients to chiropractor, acupuncture. We are very mindful that some patients might require surgical intervention, and we have a good relationship with our surgical colleagues as well. So we definitely uh, provide a whole patient approach, a team approach that focuses on providing long-term recovery for patients. One of the most common misconceptions about pain management is that we solely rely on just prescribing pain medications. And many of our patients are surprised to see that we do have other treatment options and how they can benefit from them, either whether through physical therapy, procedures. We also encourage patients to uh, maintain an active lifestyle. So we want them to be involved in the treatment planning, and we want them to ask questions and understand what's going on, and knowing what the benefits will be and knowing how things that we're recommending are going to improve their quality of life is going to be helpful in having a better outcome for them. Working with patients with chronic pain is a big responsibility. It's very challenging, but at the same time, very rewarding. The most fulfilling thing that I can identify is having the patient restore their function and go back to the activities that they love, whether it's going back to work, well, playing with their kids, or just enjoying their regular hobbies, that things that they were not able to do before. The work-on system, it's complicated system. We as pain management physicians had to kind of learn the ropes of it and go through the proper channels to provide care. It can be sometimes frustrating to get the treatment that you want the patient to have and the treatment that the patient needs in terms of approvals and authorizations. Uh, but it's important to create a good relationship with the patients. I think it's very important to maintain a good relationship with everyone involved in the team and to also explain to the patient what to expect when they come into the work comp world. So I think there's better understanding on their part when they know how things work, and just explaining to them how the authorization process work, how long are they expecting to wait in terms of treatment. They It gives them a little bit more understanding of how the whole process is going to work.